Hi, Ryan here with Business Trends TV, and today I have Dr. Michael Furlong on the line with us from Furlong Vision Correction. And one of the questions that we get a lot is regarding LASIK. And first of all, I wanted to say, is Dr. Furlong, you there?
I am here. Yes, I can hear you well.
Great. Glad to have you with us because we do get a lot of questions about LASIK and LASIK surgery. And one of the questions I think that just is kind of a basic question that I think all people want to know is, if I'm looking for a great LASIK surgeon, what should I look for?
Well, we get that question a lot here too, and LASIK surgery has become so commonplace. We hear the words a lot, and we've talked with many people, I'm sure friends and family who've gone through it. But LASIK has evolved over time, and technology's gotten better. Surgical training has also improved over time as well. So, the first thing I recommend to somebody who is considering LASIK, even if this was a family member or a friend, would be to get educated. And one way to do that is to find out the local providers, check their reputation. We in our area here we have lots of people that use Yelp as a tool to look at providers to see what kind of experience they had and also their outcomes. So that's one venue that some people will use. If you have a regular eye doctor, we also recommend that you ask them and say, who do you refer to if if your patient wanted LASIK, who would you send them to? Who in the area has good results? Who has a good reputation? And then probably the final thing is technology, because as I mentioned earlier, technology kind of drives our industry. And we started 15 years ago with first generation technology, and now we're at least 5 generations beyond that. Some providers are current and love to have the latest gizmos and the best technology. Others might use slightly dated technology too. So getting educated on that's very, very important.
Yeah, those are great points. I mean, because obviously, technology is one of the big driving factors in LASIK because obviously you're dealing with a very technical surgery, and obviously you want to be as ahead of the edge as you possibly can be, and like you said, reviews are very important, and just talking to other people in the community and other maybe even referring optometrists or anybody else, and I think that you've been there for a while. You're in San Jose, in that area, I think, correct? That's the area.
That's correct. Yeah, we're right in the kind of the heart of Silicon Valley here.
Okay, good area to be. I want to visit Google out there, or some of the high-tech places sometime. But I did want to the next area that I want to cover is if somebody comes to your practice, what are they going to experience? What kind of experience will they have?
So I pride myself and my practice on that we're very customer service driven. We realize this in our industry, even though we're in the medical field, we realize that LASIK is an elective procedure. And the patients that are looking at this are paying out of their own pocket. There's no insurance coverage for this procedure, so they have choices, and we realize that when they have choices, they're going to generally go where they feel most comfortable. So we pride ourselves on excellent customer service. All of our staff are expertly trained in the technologies that I offer, which is not just LASIK, by the way. You mentioned LASIK, and that is certainly the linchpin of what most refractive surgeons do as their procedures, but there are other procedures when LASIK's not appropriate. So I have all of the available technologies for patients who may not qualify for LASIK, and certainly there's a small percentage of patients that shouldn't have laser eye surgery or any type of refractive surgery at all. And it's my job to use our technology to determine what is a good candidate and be able to counsel our prospective patients as to what their options are, provided that LASIK is a good one. Yeah. At my office, all patients have a no obligation free appointment to come in and get screened to see if they qualify. They get to meet me at that appointment. I discuss with them their options, and then our expert staff will discuss also with them what the next steps are as far as scheduling their surgery, future appointments, measurements, and then also having the discussion about cost and financing. There's a lot of ways that we can make LASIK affordable for the average person, and we want to make sure patients who normally might not be able to afford something like this, it can become affordable for most patients in our area.
Well, that's interesting. You covered a lot of area there. I mean, obviously, so you do have you're kind of an all-encompassing first-time patient offer there. Where you give them an opportunity to talk to you guys for in essence for free and get an initial consultation that way. One of the things that I get a lot of questions about is I know that you specifically deal with some areas of expertise that other people don't deal with, and that's around keratoconus. So what can you tell me about that in particular? Is keratoconus?
Sure. Yeah. Just before I touch on keratoconus, one other point I didn't mention on LASIK, because that is one topic that we wanted to talk and cover on, is the technology. And where we are today is using an all laser technique. There's no blades, no touch necessary, and so we use an all laser technique to create the LASIK flap. It's called the bladeless LASIK technology, and then we use custom or wavefront guided technology to reshape the cornea to get rid of both nearsightedness and astigmatism, and in patients with farsightedness, that problem as well. So we have all of the technology available to treat the vast majority of patients, and that is something that patients who come into my center will be exposed to.
Well,
as far as keratoconus goes, so keratoconus is a fairly rare condition that occurs in approximately 1 out of every 2,000 people. And what keratoconus means is the cornea, which is the part of the eye where we do LASIK, it's the clear part that's covering the colored part of your eye, the pupil and the iris, that is very thin and very weakened in keratoconus patients. It tends to be a hereditary condition. And those patients generally aren't good candidates for LASIK because LASIK can make that problem worse. But our job in that, with that condition is to strengthen the cornea. And when I was in training 15 years ago, we had one option, which was to do a corneal transplant. And nowadays, we've got several safer and earlier treatment options that can help to stabilize the condition and even improve vision in patients who have this condition.
Wow, that's amazing. I didn't even know that could be treated, and that there was that distinction between the bladeless LASIK. I do want to talk to you a little bit more about that. I guess is that what they refer to as LASEK, by the way, the LASEK that I've heard about?
So there's several terms that are used, and in general, LASIK with an I, LASIK, implies that we make a flap on the cornea, and this corneal flap is part of your eye, but it's created historically with an instrument that had a blade, which is called bladed LASIK, but back then it was just called LASIK. And then when lasers were developed to create the flap more safely and more precisely than blades, then that gradually got replaced. And in my office, I only offer the bladeless technology. That's one of the two critical parts of LASIK, is creation of the corneal flap. When we talk about non-flap laser procedures, there are some patients who probably shouldn't have LASIK for one reason or another. And there's 3 terms that are oftentimes used synonymously. One is called PRK. Another is LASEK with an E, LASEK, and then the other term that's come around a little bit more recently is called EPI-LASIK, or EPI with a hyphen, LASIK, and all of those refer to what we call surface treatments, and they are alternatives to custom bladeless LASIK for patients who might not qualify for that procedure. They work equally well. They do take a little bit longer for patients to recover and heal, but the results are the same, and for patients who can't have LASIK, it's a great option.
Wow, I mean, that's really good insight. I'm sure that people that are thinking about having this type of procedure done, or any type of LASIK, because that's what everybody knows, that, this is going to help them to really make a decision and maybe understand also that there's other alternatives out there. So that's great. How do you talked about keratoconus. It's a tough one to say sometimes. But now, how do you treat that? Is there?
Sure, yeah, with keratoconus, so as I said before, it's a condition where the cornea is weakened, and so it tends to bulge outwards and become very steep. Yeah. So keratoconus, one thing we need to do is we need to stop it from getting worse. That's the first order of business. And worldwide, there's been a great interest in a procedure called corneal cross-linking, which means a technique we've been using for about 4 years that we developed from the European studies about 12 years ago, where the cornea, which is primarily made of collagen, which is a protein, is structurally weakened in that condition, and we use this corneal cross-linking to strengthen the collagen itself. It's basically a chemical reaction using ultraviolet light and vitamin B2 called riboflavin to strengthen the cornea and prevent it from getting worse. Then we also have Intacs and conductive keratoplasty, which are two techniques that are used to not only flatten the cornea because it's too steep and that causes problems, but also to make it nice and round to get rid of high degrees of astigmatism, which are oftentimes there in keratoconus. All of those affect vision, and using these three techniques can oftentimes help patients see much, much better and more accurately with keratoconus.
Wow, that's great insight. I mean, that's a very specialized treatment. Obviously, you know what you're doing when it comes to that. I don't think it doesn't sound like all LASIK surgeons are specialized enough to be able to treat that condition, I guess. Is that correct?
Yeah, in my area, I think there's 3 providers out of several hundred ophthalmologists that do the cross-linking, and it is very, very new. But it is an exciting promise for patients who especially were just diagnosed and don't want to helplessly watch their vision decline year after year, which is really kind of all we've been able to offer until a corneal transplant is required. And nowadays, we don't need to wait that long. We don't have to miss that window of opportunity. The one other thing I wanted to mention is, as part of my practice being kind of, a full eye service practice, I have the technology and tools at my disposal to not only take care of refractive surgery patients, LASIK patients, but also with keratoconus and that technology. But occasionally I'll see a patient that comes in thinking, hey, I'd like to have LASIK, and we find a different problem, a very common problem actually, called cataracts. And cataracts are actually more commonly encountered and treated in the United States than LASIK every year because of our aging population. As we get older, our lenses can become cloudy, and that's what a cataract is. And it's not uncommon. Every month I'll see 2 or 3 patients that come in thinking, hey, I'd like to see better, I'd like to have LASIK, and we find a different problem, cataracts, and we can take care of that problem too with modern-day cataract surgery and advanced lenses, which are, again, new technology options for patients so that they don't need to wear glasses after cataract surgery, which is brand new.
Wow, that's really interesting. So what you're saying is some people come in thinking that they just need LASIK or LASIK or some version of that in order to improve their vision, and really they've got an underlying foundational issue with the cataract, and you're able to identify that and treat that, and that's really interesting. What percentage of the population have, just getting back to keratoconus, what percentage of the population is affected by that?
Keratoconus is not considered very rare, but in an ophthalmologist's office like me, who's a cornea specialist, we see it pretty commonly because we're a referral source. Many optometrists in the community also see it commonly because when somebody can't see very well, they go see an eye doctor and they get diagnosed. The incidence of keratoconus in the population is thought to be about 1 in every 2,000 patients. Okay. So it's not super common, but for those patients who have it and are recently diagnosed with it, their options are limited oftentimes because of the progression of the condition. In some cases, especially in young patients, it can progress fairly quickly. It's oftentimes diagnosed in the late teens or early 20s, and some patients by the age of 30 have had so much progression, the only way they can be helped is with a corneal transplant. And that's our goal with these modern-day keratoconus surgeries, is to avoid that, to prevent it getting so bad that that's their only option.
Yeah, you want to avoid that as being, got it. That's great. Well, you've given us some great insight, and I really think that I think it's great that you're able to share with us all that you have shared. We've covered a lot of ground. I know that some people they might ask about pricing. Is there anything that you can address in terms of the pricing? I know you said that there's financing available.
Yeah, so for all of our full service offerings, some of these technologies are actually covered by medical insurance. So our cataract patients, for example, frequently have either full or very excellent coverage for surgery and surgical options. Generally, on the LASIK side, it's considered elective, so most insurance plans do not cover it. And it is not an inexpensive item. Price is oftentimes a limiting factor. But we do offer a couple of attractive options for patients. Many people don't know that you can use your flexible spending account through your employer to pay for LASIK surgery, and it's done generally with pre-tax dollars. So depending on somebody's tax status, they could save, up to 45% on the real cost of the surgery to them.
That's great.
Financing is an option, and many people take it. There's many programs out there that we participate with for patients who want to pay over a long period of time. It can be less than $100 a month. For some patients who want to pay it off a little bit more quickly and not pay interest, they can do that as well and spread those payments out over a year or 18 months in many cases.
Wow, that's awesome. So, you've given us a lot of information. Is there any parting word? Then also, I want to, before I even get there, what's the best way for people to get a hold of you if they want to reach out and call you guys?
Well, we have a very excellent resource online with our website. So it's www.furlongvision, all one word, furlongvision.com. There's just a ton of information about not only keratoconus but cataracts and lens implants and Lasik on that website. There's patient testimonials if somebody wants to click through those and kind of see what some prior patients have said. Many websites have those, but those are ours, and they can certainly peruse those. The first step would be to call our office and speak with one of our professional counselors about coming in for an appointment and meeting me, seeing what their options are. And our phone number is, we have an 800 number, but it's on the website. It's 800-573-1010. Okay. And then you asked about any kind of final thoughts. This is a passion of mine. I've been an ophthalmologist now for 17 years, and I really enjoy what I do, and I enjoy helping people. I spend my day with the opportunity to help people and change their lives in a very impactful way, depending on what we're doing, of course. But for patients, and including myself, I had Lasik done 15 years ago, and I find it very freeing and very uplifting. I can do any sport now I want, swimming, contact sports with no limitations, whereas before I would be worried about a contact lens falling out if I was swimming or something like that, and that obviously has been a huge, huge benefit. And so I really enjoy what I do, and we have the latest, like I said, technology, the best staff, and we're welcome to see any patient to see what we could do to help them.
That's awesome. Great insight, and it's great to see that when somebody's got a passion like that for what they do. I've actually put your number down here at the bottom, 800-573-1010, and then the furlongvision.com. Doc, thanks a lot for the great insight that you've given us today, and I'm sure we're going to get some questions from this video. We'll monitor the comments over time and maybe have you on again.
Perfect. Well, I appreciate the opportunity. Thanks, Ryan.
You bet. Thank you.
You're welcome.